This is Selma Schimmel at the Multidisciplinary Cancer Congress 2011 in Stockholm. Hello, Professor Dr. Abrahamsson. Thank you for making time to talk to us here in Stockholm about advances in the area of prostate cancer.
I'm happy to be here, first of all. Secondly, this is my capital. I'm happy that we are running a huge convention here, a meeting, Congress. And especially since there are a lot of new news about prostate cancer treatment that hasn't been presented previously in any other meetings. It is indeed exciting times.
What are some of the advances and what you feel are the most compelling areas of research right now and really hope for men facing prostate cancer?
Now we learn to know that, for instance, the new drugs now launched in a few weeks in Europe, they're going to make a difference for advanced prostate cancer especially. I mean, those failing classical hormone therapy, in other words, biochemical castration, surgical castration and so forth, coming back with what we call biochemical failure and also progression in terms of skeletal metastasis and so forth. So all these new compounds in the pipeline, they look very, very promising. So I would say it's a major breakthrough in the treatment of prostate cancer, especially the advanced stage of the disease.
What's the mechanism of action of these new compounds for advanced prostate cancer?
Essentially, they are acting on the androgen receptor, and we thought historically until the millennium, 10 years ago only, that the androgen receptor doesn't play that kind of a role anymore when it comes to advanced prostate cancer, especially what we call castration-resistant cancer. But it does. It is still instrumental and is the key to make progress in terms of new drugs. And that's the reason why it's so exciting to find that we now have at least 4 or 5 promising drugs on the market, or at least coming in the near future to treat our patients. And they're all targeting different levels of the androgen receptor.
Up until this point, the modality available to men for, in this case, advanced prostate cancer, how were men treated?
Now, when you fail classical hormone therapy, then the next step would be to use chemotherapy. And it was launched 2004, docetaxel, and it has been used widely across the globe. But there are a number of toxicity side effects associated with that treatment modality, and that is the problem for the patients. So I think these new drugs coming in now with limited side effects is really a major step forward.
Are these new compounds oral compounds, or are they delivered by IV still?
No, that's the difference between docetaxel, chemotherapy, because all these compounds you can give as a tablet, once or 3 times per day, and that's it. So it's very simple for the patient to administer that kind of treatment back home. You don't need to go to see a nurse or a doctor to get an IV infusion and so forth. So I think it's a really major step forward.
So it's also a shift in responsibility for the patient, because now it becomes a responsibility of the patient to be sure that they take their drugs on their own at home.
Yeah, that's going to be perhaps a little bit of a negative part of it, but if you are suffering of advanced prostate cancer, I would be very surprised if a patient doesn't really comply and follow the prescription from the doctor or the nurse to really take the pills, if it's going to be once or twice or 3 times daily.
What role do you see chemotherapy playing in the advanced prostate cancer setting at this point?
Well, at present time, those pills launched on the market so far, they are only allowed to be used after chemotherapy. But the next step would be, as we have ongoing clinical trials, to start up with these new drugs actually prior to chemowtherapy. And that is actually what my patients are asking for, because they have fear that chemotherapy has a negative taste, let's say. They know for sure, based on experience and so forth from other patients, that there are a lot of toxicity and side effects associated with chemotherapeutic drugs.
Do you foresee a time where some of these new innovative therapies will not have to wait then till the metastatic setting, but can come closer into first-line therapies?
Clearly, that is going to be the future. The only problem is, of course, the overall cost, because we are dealing with a number of drugs, and the question is still, that hasn't been solved in clinical trials, whether we should combine some of these drugs, because they are targeting different levels of the androgen receptor on a cellular level and even above the cellular level in the prostate. So that is the next challenge for us as clinicians and scientists, to really find out whether one pill per day or a combination of different kinds of pills may play a difference or make a difference for the patients, I mean.
Thank you, Professor Abrahamsson. It was a real pleasure speaking with you.
Thank you so much.